Hello everyone, my name is Avni Padang. I'm a recent medical graduate from India, and in this video I would like to be talking about cataracts. Cataracts are a relatively common occurrence in today's day. Most of us may know what cataracts are, and some of us may also have experienced cataracts. In this video, I aim to delve a little deeper into what cataracts really are, how they come about, and what can we do to prevent them. Hopefully, by the end of this video, we will have a clearer understanding of cataracts. So let's get to it. In this video, I would like to be discussing various aspects of cataracts, right from a brief introduction to what cataracts are, how they normally present, what are the risk factors, who are the people who have a propensity to developing cataracts, what is the treatment, and how can we prevent cataracts. So just to introduce cataracts, cataracts come from the Latin word cataracta, which means a waterfall, referring to the whitish appearance of flowing water, similar to the whitish appearance of a cataract in the eye. But more specifically, a cataract is what you see in this particular image. It is age-related clouding in the area of the lens. I would like to make note of the fact that there are different types of cataracts. In this video, we will be specifically dealing with senile cataracts, the ones that are associated with aging. And like you can see here, there is a clouding of the lens. What normally happens in most of us is that we have a fully functioning lens, which allows us to focus the incoming rays of light at a focal point so as to allow us to be able to see various things. It's obvious that if you have an opacity like this, there will be difficulty in focusing the incoming rays at a particular point, further leading to blurry vision and other symptoms, which we will get to in a bit. But more importantly, because of the poorly focused rays, you will have a blurry image, right? So how do cataracts present? What are the signs and what are the symptoms, right? So the most common symptom that patients often come to the OPD with are blurry vision. And like you can see in the image here, it's a very clear distinction, demarcation where you are not able to see most objects clearly. A lot of patients also complain of glare due to bright lights and often complain of glare at night when they're driving. Another common symptom is poor night vision. And if you also find that you have to change your prescription glasses at an increased frequency, then that could be a sign of cataract. Either way, each of these signs and symptoms needs to be thoroughly checked by a registered ophthalmologist. So who are the people who are predisposed to having cataracts, right? Some of these activities and conditions tend to have a higher propensity to develop cataracts, most of them which are smoking, alcohol use, chronic diabetes, excessive sunlight exposure, and aging. What is the treatment of cataract? It is important to note that most of the times, even if a cataract is symptomatic, by basic vision correction and use of brighter lights, we can symptomatically treat cataracts. However, if it does go to an extent where the cataract is interfering in normal daily activities like reading or driving, the patient experiences a reduced quality of life. And if you have comorbid conditions like diabetes or hypertension, most patients may opt for surgical management. So what is this surgical management? The surgical treatment of cataracts, the main idea is to replace the clouded lens with an artificial lens that is placed inside the eye surgically. The surgery involves removal of the cataract and replacing the damaged lens by a prosthetic intraocular lens, like you can see in the inset. This lens is made of a silicone material. It's a flexible material that is compatible with your eye, and we've come a long way in technology to be able to replace damaged lenses with intraocular lenses, which I think is fantastic, right? So finally in this video, what would be the take-home message and what should you take back regarding cataracts? So it's very important to note that about 66.2% of all the cases in the world today are because of cataract. And that's a large number, and that's a majority of the cases responsible for causing blindness in the world today. With the introduction that I've given you before, it's now very clear that cataract is an extremely manageable cause of blindness, and that's why this number now needs to come down because of the advancement in technology and the way we can handle cataracts today. So how do we prevent cataracts? Some of the most important methods could be using anti-glare glasses, protecting your eyes from UV radiation, quit smoking, a deliberate control and elegant control of sugar in diabetes, and most importantly, regular eye testing. So with that, I'd like to conclude this video. It was a short, brief introduction to what cataracts are, and hopefully this video was informative as usual. Thank you very much and have a nice day.